My name is Nicole Votruba. I'm a researcher at the Institute of Psychiatry, Psychology and Neurosciences at King's College London. Today, I want to talk to you about three things. Why mental health is important for policy, why there is a critical gap between science and policy making, and how the EVITA Action Framework can help scientists to improve mental health by changing their relationships with policymakers. I work in global health. So when we think about global health today, what immediately comes to mind is the coronavirus pandemic, which currently affects millions of people worldwide. Or you might think of HIV or malaria, or perhaps the terrible Ebola crisis a few years ago. But there's one type of condition that affects many more people. It affects 1 in 4 people. It is mental illness. 1 in 4 people have a mental disorder in their life. This means about 20% of the world population has an illness each year. But over 2/3 of people with mental illness do not receive treatment. And most people with mental health conditions live in low and middle income countries. But in low and middle income countries, even fewer people receive treatment. In low income countries, less than 10% of people with severe mental disorders are treated. This is what is called the massive treatment gap. There's also a high and early mortality for mental illness. 8 million deaths per year occur, which is roughly 14.3% of all global deaths. The real contribution is likely to be even higher because of complex interactions and comorbidity with physical and mental illness. In high-income countries, for instance, women with a mental illness die 15 years earlier, and men die even 20 years earlier. So we know that mental disorders are killer diseases. And mental health and many common mental disorders are also shaped to a great extent by the health, social, economic and physical environments in which people live. The situation in low and middle income countries is even more challenging than in high income countries. Policies are a first step to implement and improve mental health systems and services. But in many low and middle income countries, mental health is not on the policy agenda in the first place. In 2015, the United Nations Sustainable Development Goals set a global development framework, or policy if you like. And the SDGs are 17 goals, 169 targets, and 230 indicators. However, of those 169 targets, only 2 are on mental health. And out of the 230 indicators, only 3 are on mental health. So these are really indicators to measure what the policy outcomes are. This is not much if you consider that mental health affects and has cross-links with most of the other SDGs, such as poverty, economic growth, or gender equity, for instance. They're all strongly influenced by mental health and vice versa. So why, even though we know so much about the importance of mental health, why do policymakers not consider it in their policies? One reason for this is stigma. Stigma means that people have prejudices and negative attitudes against themselves or against people who experience a mental health condition or did so in the past. These people experience discrimination by individuals, by their friends, by their families, but also by their communities, through institutions and their governments. For instance, you don't get a job or a partner, or as in Germany, you don't get life insurance if you have or ever had in your life a mental health condition. Luckily, things are starting to change. More and more people are speaking out about their mental health problems. And famous people play an important role in reducing the stigma and mental negative attitudes that we hold against people with mental illness. For instance, Lady Gaga spoke out about her struggles. Prince William opened up about his mental health issues. And even policymakers, such as here the former Norwegian Prime Minister, He experienced depression while he was Prime Minister. He openly talked about it. He sought professional help. He recovered. And he was re-elected as Prime Minister. But the process in translating mental health research into policy and practice remains difficult. When we look at the COVID-19 case, for instance, in the UK and in many other countries, we saw massive criticisms of policymakers' use of evidence. Throughout the pandemic, it has been pointed out by scientists how mental health is crucially affected. The tragic ways in which frontline health workers' mental health must be suffering. And just recently again, it has been warned that ministers must improve the way they use and communicate advice from scientists, or they risk repeating mistakes made earlier in the pandemic. So why is it so difficult for policymakers to take scientific evidence into account? Are they just not interested in science? Well, this may be true for some policymakers to prefer other sources of inspiration for political actions, but for most policymakers, actually, the reality is quite different and very complex. Policymakers are busy. They have to deal with a great number of different urgent and important issues at the same time. And they have to handle evidence from different policy areas, health topics, or even contradicting evidence in science. They have to navigate in a network with a wide range of pressing issues. And while scientists may not always have one single truth available, they can give policymakers a guidance and a map to help them navigate through the evidence and to understand how a seemingly small issue like mental health has a major impact on many other issues. For instance, in relation to COVID-19. I have developed a framework to help scientists and policymakers navigate through these challenges and improve the translation of mental health evidence by focusing on the agenda setting stage. What do I mean by that? Okay, let's imagine a simplified model. We have research, policy, and practice. Some research directly informs practice, which is what is called implementation science. There's also a direct link between policy and practice to implement policies. But in order to improve the uptake of science and policy, we need to focus on the agenda setting stage, so more and better evidence-based policies can be put in place. What is agenda setting? Agenda setting occurs when a topic gains and maintains the attention of policymakers. It's also called policy priority setting. It involves identifying, defining, and prioritizing problems for policy attention. And it is a policy pre-decision making process and a critical mechanism for the formulation, adoption, and implementation of policy. I've developed the Evidence to Agenda Setting Framework, EVITA, specifically for improving the translation of mental health research into policy in low and middle income countries. How does EVITA work? Well, we have research clouds, we have the policy sphere, and we have enactors, where research and policies are being implemented. They're all linked through intermediaries who understand the different worlds and their languages. Key people can be identified in each of these areas who are dedicated, engaged individuals. And everything is embedded in an external context, which can differ for each country. There are mechanisms that can support these interrelationships, such as capacity, engagement in relationships, or framing and aligning of the evidence. So for instance, presenting a policy problem that is very clear and offering a policy solution. And another mechanism that is very helpful is using behavioral incentives. Advocacy coalitions can support a very clear and single policy ask and bring this all together. And then when this all comes together, catalysts occur, so incidents where mental health receives public and political attention. For instance, right now during the COVID-19 crisis. And the political will should then increase and policy windows open up, and then research is taken on the policy agenda. Getting research into policy and practice is challenging, and efforts often fail, particularly for mental health in low and middle income countries. The Evita Framework can help facilitate the process to translate scientific evidence more effectively into policy. Evita was developed based on a systematic review and validated in a multi-level case study in South Africa. Evita is for mental health researchers, policy planners, NGOs, and others who are working in mental health. Evita aims to improve science-policy relationships, which eventually should help more people gain access to the mental health care they actually really need. Thank you for your interest, and thank you to my many colleagues and to my funders. And if you thought this was interesting, do follow me on Twitter or contact me.